Kenya Union of Clinical Officers, KUCO, today held protests outside Afya House, calling out the Social Health Authority Board for discriminating them and locking them out as service providers under shift.
Under NHIF, the clinical officers were allowed to register their facilities. But when Dr. Abdi and his team sat illegally against the SHA Act, against the Health Act, against the Clinical Officers Act, they decided they are not going to empanel and contract facilities by clinical officers. And this means that more than 6 million Kenyans cannot be able to access health services.
Claiming that the board is corrupt, they want the SHA board to be reconstituted.
Dr. Abdi Mohammed and his team must go home.
Your board is the highest ranked medical personnel ambaye ni Director General. Hata yeye ameungana mkono kuvunja sheria. Kwa hivyo hatoshi kukaa katika hiyo ofisi.
Clinical officers no SHA. These have been the chants reigning these demos. They say they have been excluded as service providers, yet they run over 1,000 healthcare facilities.
98% of the ophthalmology and cataract surgeries are done by clinical officers. Majority of the ENT procedures are done by clinical officers. Most of the oncology services are done by clinical officers. For them to deliver that quality service, they must pre-authorize diagnostics, they must pre-authorize procedures.
They have now threatened to down their tools come 23rd this month if the government fails to heed to their demands. Meanwhile, interns from the Kenya Medical Practitioners, Pharmacists and Dentist Union, KMPDU, also staged their protests. They lamented over 4 months' delay salaries, yet the ministry had promised to pay their arrears an allocation of 965 million shillings. However, the amount is yet to reach their accounts.
And you know what we have been paid? We have been paid nothing for the 4 months. The ministry, which is full of PR, on Saturday the CS made a press conference saying she deposited and she has paid the interns in full. We want to tell you media house, that that's not true.
Now Humicha reduced to 70,000, which was a stipend. Up to now, as we talk today, others have received that money, but like personal, it's like 33,000 in a month, which is wrong because we agreed to 70,000.
Meanwhile, Health Principal Secretary Mary Mudhoni defended the disbursement of 965 million shillings to intern doctors.
Our interns have been in the field without pay, and right now, the court has given us 90 days to have a conversation with them. And secondly, His Excellency the President set up a task force to look into all the issues regarding the interns. It is important to note that the government is committed. This week, we have released the intern stipend as set by the SRC. The court has directed that we are given 90 days to discuss whether to pay 206 or to pay 70.
They have also vowed to down their tools come 22nd December. Harriet Chimea, K24.